Hello everyone, this is Yash Saxena and you are watching SwadeshiVIP, and in this video, we will be discussing the lumpy skin disease in cows. Commonly known as LSD is a viral disease of cattle and water buffalo that causes relatively low mortality. However, the disease can result in animal welfare issues and significant production losses. The disease is caused by a Capripox virus. In 2019, LSD was discovered for the first time in Asia and the Pacific, in northwestern China, Bangladesh and India. LSD continued to expand across continental Asia in 2020 with outbreaks reported in Bhutan, Hong Kong, Myanmar, Nepal, Taiwan, Vietnam and Sri Lanka, and among other countries. The disease was detected in Vietnam and Thailand and Malaysia in the year 2021. In March 2022, Indonesia reported confirmed instances. Biting insects such as certain types of flies, mosquitoes and possibly ticks are the primary carriers of the disease. Formites can also spread the disease through contaminated equipment, and in some situations, direct contact is not harmful to people's health. Infection usually results in an acute illness with fever, depression and distinctive skin nodules. There may be significant drop in milk production as well as abortion in pregnant animals. It is not fully understood how lumpy skin disease virus is transmitted between animals. It is believed that arthropod vectors, direct contact, contaminated feed and water, and iatrogenic means repeated use of needles or different animals can also spread the disease. The virus is present in high concentration in the skin nodules and scabs on affected animal and can be isolated from blood, saliva, ocular and nasal discharges and semen. Lumpy skin disease virus can be found in blood for up to 21 days post-infection, but shedding in semen may continue for at least 42 days post-infection. So, how can you identify whether your cattle is infected or not? The incubation period is between 4 and 14 days post-infection. After an initial period of high fever, that is 41 degrees Celsius, and swollen lymph gland, the animal may develop large firm nodules that are up to 5 cm in diameter in the skin. These can be found all over the body, but particularly on the head, neck, udder, scrotum and perineum. The nodules may become necrotic and ulcerate, leading to increased risk of fly strike. Dairy animals in peak production are frequently the most badly impacted, with milk production dropping dramatically. Excess salivation, depression, anorexia, rhinitis, conjunctivitis and are possible symptoms. Necrotic lesions in the respiratory and gastrointestinal tract can develop in severely infected animals. The disease can be mild up to 50% of cases in an outbreak, or severe up to 50% of cases in an outbreak. When an outbreak occurs in a knife cattle community, morbidity can range from 4 to 45% and death is usually less than 10%, although both rates can be much higher. So, now it's time that we tell you about how to prevent it and control the LSD disease. If you catch it soon enough and the cow merely has fever, you can merely provide it with a non-steroidal anti-inflammatory medication to assist in lowering the swelling. It has been reported to be efficient in research. Antibiotics will be required for cows with serious pain. As immediately as you notice the first indication and symptoms, take them to the vet. However, our first recommendation is that you employ all the available preventive measures to avoid LSD at all costs. It is critical to maintaining hygienic conditions on your farm at all times. Also make sure don't bring any hybrid animal or object home with you which could carry the sickness. And as we all know, prevention is better than cure. Try to feed your cows a good diet to help them establish a robust immune system. So I hope the video was informative for you. Thank you so much for watching SwadeshiVIP.